There were 37,000 cases of microcephaly in Brazil last year when the Zika virus emerged. This fact is of great concern to the Caribbean Public Health Agency, CARPHA, which has sprung into action to prevent the disease spreading further into its member states. So far, Barbados, Haiti and Guyana are the only CARPHA member states with confirmed cases of the virus. Speaking at a press conference on the Zika virus Monday morning, Executive Director of CARPHA, Dr. James Hospitalis, says there are two aspects of the Zika virus that are particularly worrying.
One is the microcephaly, babies born with small heads, of mothers who got Zika in pregnancy. And in Brazil, there's been a big increase, as you probably know, 3,500 cases last year. If that rate applied to the Caribbean region, the CARPHA member states, there might be something like 300 cases. And a country like Trinidad and Tobago, 20 to 25, to give some perspective. The second is a significant increase, apparently, in people with a neurological disease called Guillain-Barré syndrome, where your limbs get weaker, and in severe cases, life support may be required. There is no specific treatment or vaccine, so prevention is the key.
Dr. Hospitalis says persons who contract the Zika virus should avoid being bitten by mosquitoes within the first week of the virus, as that's when it can be transmitted. Meanwhile, the CARPHA head notes that the fact that the Zika virus is taking on the magnitude of the chikungunya virus 2 years ago means that the mosquito control initiatives of the different countries are not working.
This is why at CARPHA we have flagged this issue to the highest policy level and are taking the necessary steps. Last week, I spoke to the Secretary General of CARICOM, Ambassador Erwin LaRocque, to alert him to the possible health and economic impact of this so he can brief the heads of government at their intersessional meeting shortly. We have, as I mentioned earlier, the partnership with the Caribbean Tourism Organization and Hotel and Tourism Association, aiming to improve the quality and the competitiveness of the hotel and tourism industry, particularly by focusing on health and hygiene and environment measures. And we have a partnership also with the Inter-American Development Bank that's providing some funding to build up these systems. We have linkages with academic institutions in and out of the Caribbean to research this problem. And with the CDC, Centers for Disease Control, the Public Health Agency of Canada and Public Health England, and soon Holland and France, CARPHA has established a monthly travelers network for the Caribbean where these provides a forum to discuss with these international public health agencies what is going on in the region.
So far, 22 countries in the region have confirmed the presence of the virus on their shores, bringing the number of countries around the world with cases of the Zika virus to 24.